Welcome back to Early Edition. The Secretary General of the United Nations warns a cut in U.S. funding for the UN Population Fund could have devastating effects on vulnerable women and girls around the world. Washington had said it was withdrawing funding for the UNFPA, an agency that promotes family planning in more than 150 countries. About $32.5 million will be pulled out for the 2017 financial year. And here to tell us about what this means for countries like the Philippines, we are one of those 150 countries, Klaus Beck is the country representative of the UNFPA. Good morning, Klaus. Thanks for being with us this morning.
Good morning, Annalisa.
Well, let's talk about the cut first. Obviously, this is not the first time a Republican administration in the U.S. has cut funding to the UNFPA. They fundamentally disagree with any kind of abortion-related services, even counseling. Now, can you explain exactly what the relationship is with China, because that's something that was a sticking point for them, especially since their population control methods are considered controversial?
Well, I mean, UNFPA gets funding from many different member states around the world, including the U.S. And in 2016, the U.S. gave us about $69 million overall for our work. And through that work, we've been able to prevent about 1 million pregnancies and about 300,000 unsafe abortions, and saved about 2,300 lives. So it really matters a lot, the funding we get, and basically our funding is voluntary funding. So we're not kind of an organization that gets funding that is fixed every year. We actually have to go out and mobilize funds. So that's why any contribution that we get really helps do our work better in all countries.
Mm-hmm. Do you find that the sticking point with supporting in China is something that will deter countries from helping fund this program?
I don't think so. I mean, we have a lot of supporters. We have, I think last year, about 130 countries were contributing to UNFPA, globally speaking, including the Philippines. So we do get a lot of support. There are many countries that have decided to revisit their funding and step up their funding for family planning, reproductive health in light of the changes in the U.S. government. So there are also some bright spots in terms of what might happen going forward. There was a conference in the Netherlands not too long ago where about 180 million euros were committed by countries for family planning under an initiative that's called She Decides.
Mm-hmm. Now tell us what the money goes to here in the Philippines. What kind of services does the UNFPA have?
Sure. So basically our work, we support governments in implementing their development priorities and also in living up to the commitments they have made internationally. So we work very closely with government. A few examples of what we do is that we help provide information and evidence that informs policies and programs. So an example is the new Philippine Development Plan has a chapter in there on the demographic dividend, and that was basically put together based on a research that we funded together with government. So that's one example of what we do. Another example is we help government implement laws and like the RPRH law, Responsible Parenthood and Reproductive Health Law, or the Magna Carta of Women. So we help support that, for instance, contraceptive logistics chains get strengthened, so how contraceptives move throughout the country. And in the southern part of the Philippines, we've been helping last year provide an upgrade to a facility in the MILF Camp Darapanan, where we provided medical equipment and training to that facility. And as a consequence, they were able to get accredited to PhilHealth. So those are some of the different things that we do in the Philippines.
Now, we were talking a little bit before at the break about how important it is to have laws in place to kind of show that the government is supporting these types of services. How has this administration helped in terms of reproductive health? Have you worked closely with the Duterte administration?
Very closely, and the Duterte administration, even going back to the president's SONA, very clearly outlined that he wanted to make sure that the RPRH law was fully implemented. So there was really strong support.
Just to remind people about the law that you're talking about, RPH, the reproductive health.
Yeah, the Responsible Parent and Reproductive Health Law that was passed in 2012, and basically that helps provide access to family planning, particularly for those poor and less fortunate who cannot afford those services themselves. And the government is mandated by law to provide those services to them. And the government has decided that this should be an integral part of the development agenda to fully implement this law. So a very strong support from the current administration for this.
And we've been talking also about the challenges, though, because of course it's a conservative country, the Philippines. We're largely Catholic, that doesn't believe in abortion-related services or anything like, or family planning. You know, even that there's that fundamental belief that you shouldn't be, government shouldn't be involved in reproduction. So how do you navigate that? Because it's very entrenched in our culture.
Well, I mean, in fact, family planning is the way to prevent abortions from happening. If you're able to plan your family and make decisions about when and if and when to have children and how many to have, then you're really able to make sure that that you don't have these cases of abortions, for instance. So, and the other thing is that there's actually a lot of support for family planning in the Philippines. When a law was put forward, surveys consistently showed that 75% of the population are supportive of that law. So there's a very large majority is actually in support of the law.
Okay, and on the local level, though, what challenges have you seen in terms of enforcing the act? Because, you know, we've been hearing reports about some local officials that just don't want to implement some of these services that they don't agree with fundamentally.
Well, I mean, implementation is uneven for that law, as it is probably for other areas. So the work really is about making sure that we work with local chief executives to make sure they understand the law, understand how family planning can actually help their communities. And actually, there's a program we supported, which is basically led by the Swedish Family Foundation, which really works on leadership for health. And it's about lowering maternal mortality, which many local chief executives actually may not have fully thinking about it before, but when they get exposed to this type of program and what they can do for the people in the communities, they can really get on board with it and work closer together with their municipal health officer or provincial health officer. Then they can really make a big difference. And actually the results of that program shows that if local chief executives get involved, they can really make change happen at the local level. So leadership is critical, as of course is making sure supplies are there, that health service providers are there, but as with many things, leadership is a critical component.
How hard of a hit will the local UNFPA take with this cut in funding? Will you find other sources to kind of finance your programs?
Well, it's still early days because the decision was just communicated on Monday, so we don't yet know the full consequences. But the U.S. funds is about 7% of our overall funding for UNFPA. So we will expect that a similar that will be the cut in a way overall. We are always looking for additional funds, obviously, and we'll look to other partners to see whether they'll be willing to help provide additional funding for our work here, whether it's the private sector or international donors or even private individuals. So we are hopeful that we will be able to get additional funding, but of course we never know.
Okay, and just on a larger note, for the broad picture, the reproductive health and maternal health in general, very important in terms of empowering women in countries that may traditionally have been stuck in a cycle of poverty.
Yes.
How important is it to have programs like this in countries like the Philippines?
Well, it's really important. I mean, we have done comparative analysis of different countries, Thailand, Korea, for instance, and the Philippines, and it shows that South Korea and Thailand, when they started implementing the family planning program, they were really able to first of all make sure that women decide how many children they want, get their unmet need for family planning met, and then overall it had a really strong effect on their economic growth. I mean, if you look at Thailand, the Philippines, and South Korea, in 1950s it was about the same size of the economy, same size of the population, and now basically the GDP per capita, I think, of Korea is about 10 times as high than the Philippines, and it really means that if you do invest in this area, you can really make a big difference, not only in the individual lives of women and girls and families, but also for the broader economy of the country. And that's also, I think, why the Duterte administration wants to invest in this, because it's one way to also help reduce poverty.
Okay, well, I am all for empowerment of women, and I'm sure a lot of people of our viewers as well. Thank you so much for joining us this morning, Klaus Beck. He is the country representative for the UNFPA.